Welcome, everyone. I'm Bruce Baker, and this is another talk in the series on the history of New Orleans. This evening, I'm talking to Dr. Kevin McQueeney of Nichols State University in Thibodaux, Louisiana. And Kevin is a historian of Black healthcare in New Orleans. And since we're doing this interview in the middle of the COVID-19 pandemic, I thought it would be interesting to hear his thoughts on how his experience as a historian of race and healthcare in New Orleans has affected what he's observed of the current pandemic. Kevin, what are your thoughts on this?
Well, it's such an interesting time to be writing about healthcare. At the time period that I was doing my work, I was finishing up my dissertation on healthcare in the spring. And I was, working on my final drafts and doing my final essays. And I was writing the introduction to my work. I'd done the work and I was trying to kind of make sense of what I was actually writing about. And so I was writing the introduction to this during the middle of it, and then COVID happened. I think it helps you kind of reflect upon what's going on. And for me, so I got sick with COVID and I was sick for a long time. And I think it gave me an interesting insight into that system, because what happened in New Orleans, I think, reflected what was going on in larger places in the United States. Lower income residents and particularly African-American residents were disproportionately impacted by COVID. And they had much higher rates of contracting COVID, and then also of higher rates of mortality. When I wrote my dissertation pretty early on, the mortality rate for African Americans was really high. I think at the time period in April, which was kind of the peak here in New Orleans, African Americans are about 33% of Louisiana residents, and they were about 70% of the COVID deaths. I mean, it was just super high disparity. And I think was a moment in time that people were taking a look at health inequality, and I think it was an important conversation. Anthony Fauci, he spoke about this, and he talked about the racial health disparity and how hopefully after COVID we would continue this conversation and we would take a look at some of these factors and address these things. And this is something that I'm hopeful towards too, that COVID, I think, provides a window into the reality of health inequity in New Orleans and in other cities throughout the United States. And for a lot of African-American residents, there is this racial health disparity. The reality is that historically, there's a lot of factors that have led into it in the healthcare field and a lot of the health field. They talk about this idea of social determinants of health, these factors that contribute to your health your health, the things that contribute to your life expectancy, the things that contribute to whether or not you're going to be susceptible to disease. And the idea is that it's not biological factors, it is the social conditions. It is access to healthcare, but it's also employment, it's education, it's the neighborhood that you're growing up on. Is it a safe neighborhood? It's exposure to pollutants, right? And I think part of the reason, one of the major reasons that Black New Orleanians died and had higher rates of COVID was that African Americans have much higher rates of unemployment in New Orleans, much higher rates of poverty, lower rates of access to education, lower rates of healthcare insurance, lower rates of access to healthcare in general, exposure to pollutants. So, there was a lot of discussion about comorbidity, the idea that one of the reasons that a lot of people have died from COVID is if you have a pre-existing medical condition, COVID can exacerbate that and make it much more likely that you're going to die. And African Americans have much higher rates of this, and it's not because of some type of racial characteristics or biological factors. It's the fact that African Americans suffer from other problems because of the negative social determinants of health that they face. the New Orleans Health Department has done a lot of surveys on Black residents and written Black reports, and they found that in the 2013 that Black New Orleanians suffered from hypertension or high blood pressure at a rate that was 65% higher than whites, and this puts them in a much higher risk category from dying from COVID. Diabetes rates 40% higher. African Americans in New Orleans today are 6 times more likely than whites to contract HIV or AIDS. They are twice as likely to die overall from diseases like HIV, AIDS, and the mortality gap exists for African Americans across the board. I think you saw this with COVID, that the Black mortality rate was so much higher, but the reality is that African Americans in New Orleans and in many American cities, they're much more likely to die from other diseases. Black New Orleanians are 1.33 times likely to die from heart disease, 1.5 times likely to die from cancer, 2.3 times more likely to die from kidney disease, 3 times more likely to die as an infant. There are all these other pre-existing health conditions, and it is because the history of the negative social determinants of health that African Americans in this city have faced. From the antebellum through Jim Crow, African Americans face discrimination and prejudice, and this is something that I think a lot of healthcare experts and social scientists have found, is that now discrimination and racial prejudice itself, it impacts your health. It causes stress on your body to be constantly exposed to this, and this makes you much more likely to contract diseases or to die from a disease. The historic factors blocking access to healthcare has also been tied in with employment. African Americans have faced a lot of barriers to getting jobs, and in the United States, if your employment is tied into your job and you can't get jobs, well, then you're not going to get healthcare, and so many African Americans don't have access to healthcare. But the high poverty rate, I mean, it's a direct impact upon the health quality of your life. I think the thing that I always found, I always find most shocking, and this is something that when I talk about healthcare, I always use the statistic that if you were born in the Hoffman Triangle neighborhood in New Orleans in the early 21st century, right? It's a neighborhood that's predominantly Black, it's predominantly low income, it's close to Central City, it's this very heavy concentration of African Americans. And the life expectancy, if you're born there, even to this day, it's about 62 years of age. And meanwhile, if you are born in Lakeview, which is separated from Hoffman Triangle by just a couple miles, you could walk there, you could be there in a 15, 20-minute walk. And yet the life expectancy for people born in Lakeview, which is predominantly, it's almost all white and it's high income, it's 88 years. And so there's a 26-year age gap just based upon where you are born, the zip code, zip codes that are almost next door to each other. And so much of it's because the residents that are born there aren't going to have access to education, aren't going to have the same opportunities for jobs, are going to be born in neighborhoods and that they're exposed to pollutants. This is a history of New Orleans too. African Americans predominantly live in areas where they're exposed to air pollution, to water pollution, to carcinogens. Louisiana has the history of Cancer Alley, which is this area running from New Orleans through Baton Rouge with high concentrations of petrochemical companies. And as a result of this, they are exposed to these chemical and air and water pollutants and high rates of cancer. African Americans in New Orleans have higher exposure rates to things like lead poisoning. There has been a real history of exposure to lead in the public housing buildings that were built in the mid and late 20th century. They used lead paint, and this exposed African Americans, who became the predominantly the residents of those public housing units. They have really high rates of lead poisoning, and the federal government didn't really do anything about it, and the city government didn't do anything about it, and there were major lawsuits about this starting in the 1990s. A lot of these public housing buildings were also built on top of landfills. The city's biggest landfill that they operated from the early 20th century through the mid 20th century, they closed it, then they reopened after Hurricane Betsy and put a bunch of debris from Betsy. They built a Black housing unit on top of this, and they didn't remediate it. They just poured some sand over it, and then they said, all right, here's where we're going to build a Black housing project. And they sold it to African Americans as here's an opportunity for you to buy a home. And so it was kind of this public-private project, and they created this Black community. And then all these students kept on getting sick. They built an elementary school on top of this dump, and all these students and all these residents got sick. And eventually the federal government came in and they shut it down as a Superfund site. And so, you know, it's also a story about comorbidity, that if you're exposed to all these other things which impact your health, when something like COVID comes along, it is going to disproportionately impact people who've already been exposed to negative social determinants of health, who already have health problems, who don't have access to healthcare. You know, I saw this, and this is something that I thought a lot about when I got sick with COVID. I was fortunate that I had healthcare, and even then it was, I mean, the healthcare system was shut down, and it was hard to get access to it. And it took a while for me to see anybody. And I, finally went in and had to go to the hospital. And I was fortunate that I was treated and that I was able to survive. But there was a lot of Black patients that weren't, they were turned away. I ended up going to the emergency room at Ochsner at one point because I was having so many health problems. And I was fortunate that I got treated. And but they did a study that came out, and they found that Ochsner was turning away a lot of Black patients this summer. They had health problems, and they went in, they tried to use Ochsner, and Ochsner sent them back home, and they died at home. And if they'd gotten treatment, they could have lived. I mean, this was dozens of Black patients who died who could have been treated. And, I think about my own experience where I was fortunate that I did get that. And, it saved my life. And if, situations were different, right, that easily could have been me. But here I was, I did have healthcare. I was white, and I was able to use this institution. And African Americans who use that same space, who had the same health problems as I did, they were turned away, and then they died at home. And I think that this is an experience that a lot of African Americans face still to this day. There is the legacy of racial discrimination in healthcare institutions. There is a history of turning them away, of not treating them, and also of not treating their symptoms seriously. This goes back for hundreds of years. In the 19th century, there was ideas of, pseudo-scientific ideas of racial inferiority, where they talked about how there's racial differences between Blacks and whites, and that African Americans are racially different and they're racially inferior. And this idea is perpetuated by doctors. I always give the example of Samuel Cartwright, who's a prominent physician from New Orleans, who writes this very prominent text about diseases of African Americans. And he talks about how enslaved people suffer from diseases that mental diseases that make them likely to run away, and that they run away from slavery not because it's terrible, because they want to get freedom, because they're suffering from some type of mental illness. And it's all junk science, but people buy into it. And then that healthcare institution run by those same doctors who buy into these ideas of racial inferiority, they do experiments on enslaved people and on free people of color in the antebellum period, where they say that African Americans are inferior. There's these ideas that they don't feel pain the same way that whites do. And they do all these healthcare experiments on African Americans. And the benefits of those go to whites, right? The field of gynecology is, based upon experiments on enslaved people by people like J. Marion Sims. And he's a doctor, operating out of Alabama. And he comes and teaches a lot of people in New Orleans. And doctors in New Orleans are doing the exact same type of thing, where they're doing these experiments and then they apply the science to whites. You have this history of healthcare in the United States that is tied into experiments on enslaved people, on exclusion of African Americans. And I think a lot of those legacies are still felt to this day, where hopefully doctors aren't, still buying into ideas of racial inferiority, but there is still racial bias in our system. There is still, they've done a lot of surveys that have found that doctors still think that African Americans come in now and complain about healthcare conditions that aren't real, about health conditions that aren't real, and so they turn them away. And I thought about that a lot for COVID patients, because this was the experience of a lot of Black patients where they would go in and doctors would kind of dismiss them. They would say, your conditions aren't that bad, come back later. And they go home and then they die because it happens so quickly, and they say, I can't breathe. And then, you think about that phrase, and now it's so much associated with George Floyd and these victims of violence by this white police system. And it's the same phrase that Black patients are coming into healthcare hospitals and they're saying, I can't breathe because, COVID has gotten into my lungs. And white doctors saying, oh, it's not that serious, go home. And then they go home and they die. I think you have these historical legacies of racial discrimination which continue. And it's partially, it's the racial discrimination in healthcare, but it's also all these other historical legacies of these negative social determinants of health, which have resulted in the fact that African Americans have died at much higher rates of disease. And I mean, it's really decimated the Black community here, much higher rates of disease, and some really prominent figures of the community too. What really hit me was when Ellis Marsalis died of COVID, and he's such an institution for New Orleans, one of the patriarch of this incredible musical family, and here's somebody like that, and he is subject to this and he dies, and it's so sad. And you have the president of Zulu who dies, right? I mean, you have these prominent Black leaders, community leaders who are dying, and then they're victims to this. And then, I think it's also sad too, because one of the things for New Orleans is the jazz funeral, and they can't even get a jazz funeral, a send off to this. And I think that speaks a lot about the ways that disease, it doesn't just operate in this kind of vacuum, that it is a larger reflection of the problems in the healthcare system. And these are historical problems. And this is why I'm hopeful that Americans will continue this conversation afterwards. I'm not sure if that will actually happen, because it just, it hasn't happened after other epidemics, but I'm hopeful that it does.
That's kind of that's sort of what I was thinking is, in a way, you sort of hope that these sort of really big epic crises, and New Orleans, it might be safe to say, I don't know if it's had more of them than other cities, but it certainly has had some major ones, the yellow fever epidemic and Hurricane Katrina, and now this. You sort of hope that will bring all of these problems into sharp focus in a way that, maybe sort of when they're more day-to-day structural problems, they're not as easy to see, or they're easy to get used to. But a crisis like this maybe brings it into sharp focus, and then we can see what the problem is and we'll fix it. But maybe this will be the time when that happens.
I'm very hopeful. Unfortunately, I think Katrina, offers a lot of lessons about how that might not happen, because, if anything, Katrina happens, and, I remember the same conversations people were having about, wow, people from all over the country were like, this poverty that exists, New Orleans is the second, highest rate of poverty after Detroit, and it has the worst school system, and all these negative things about New Orleans. And there was this moment in time when people could have done things about it, and a lot of those things haven't really gone away. Things have gotten worse in some cases. Gaps between the wealthy and the poor have exacerbated. The economy is still based around tourism and service field, which is, pays so poorly. The school system, it's a weird hybrid now of every school in New Orleans now is charter schools, and it's, weird experiments on education, sometimes at the expense of the students, which are predominantly Black. It is the increase in gentrification. The city's become more gentrified post-Katrina. It's, in some cases, I was hopeful that we could have this conversation, and then that things would change for the better, and that a crisis would lead to change. But a lot of times it doesn't, and healthcare was one of these, was same things. There was a discussion about healthcare after Katrina, and some things did improve and a lot of things didn't. Charity Hospital gets closed. Charity Hospital, which is, the institution which is the predominantly Black serving hospital, the public hospital, it's a story about segregation and healthcare inequity leading up into Katrina, and it's not fair that that's the system that is the only option really available for African American residents. But the answer is not to shut down Charity either. Charity gets closed, LSU refuses to open up Charity, and the one institution that is open to African Americans in healthcare gets closed and doesn't open for 10 years. Wow. So there's this main Black serving hospital is closed, and LSU makes a decision not to open it up when they could and should have. And a lot of Black residents suffer and they die because of that decision. And it doesn't open again until 10 years later. It's a smaller institution. It has changed its mission. They dropped the charity model. They're now opened up as a tourist-based hospital. Their entire model is now that they are a cutting-edge university hospital, which is great. They provide really great care. But the thing that they want to attract is they want to attract people from all over the country, all over the world to come do these, cutting-edge surgeries and this research that'll give them a ton of money. And they don't care about serving the community as much anymore. And it's meant that a lot of African Americans have less access to healthcare post-Katrina. And the only positive things that have happened, there's been more healthcare clinics that have been opened up by community organizations. There's been more federally sponsored healthcare clinics, which has been good. So that's been a positive. More preventative care, more primary care open to residents, including African American residents. But some of the other care systems like Charity have closed. New Orleans East, which is predominantly Black, which was a white flight suburb originally, became a Black community in the 1980s, 1990s. It's served by one hospital. That closes with Katrina, and they don't get a hospital until 2014. And it's the same story of here's this predominantly Black community, and they have nothing. There's no hospital that's serving that community. And so I'm hopeful that we can kind of learn from the mistakes, and that maybe we can apply these lessons that, yellow fever, they did eventually after decades where they finally figured it out, and they did something about healthcare, and they closed the cesspools, and they decided to, create sewage and get rid of the water source. And then after 1905, you don't have yellow fever epidemics. And so the city does something positive. Bubonic plague, right? They finally do something about it, and because we're having outbreaks of bubonic plague, and they finally do something about it and they eliminate it. Yeah. But they're doing it because it's also predominantly affecting a lot of white residents, and they do something about it. Meanwhile, tuberculosis for whites, they do public health campaigns in the 20th century and get rid of that, but they don't carry the same things out for African American residents. So healthcare problems that have affected African Americans, like sickle cell anemia, there have been some things that have been done for it, but when diseases and healthcare crises disproportionately impact Black residents, there's not the same political capital or social capital or investment into these issues. And so I hope that it starts this conversation, and that I think one of the problems is that in order to really address things that COVID have revealed, you'd have to get rid of a lot of the institutional racism that exists. And that's a hard fix that I don't know if people are going to be willing to do, because you're going to have to increase healthcare, you're going to have to increase education, you're going to have to increase access to housing and jobs and all these other institutions in order to prevent things like this from happening. And that's the hard fix, that closing a cesspool, doing kind of these things that can eliminate some of these exposures, that's one thing that you can do. But the harder fix of dealing with institutional racism, which New Orleans and a lot of places in America have been unwilling to do, I don't know if that is necessarily going to happen. I'm hopeful that it does, and I'm hopeful that we're going to have the same conversations that we're having about policing institutions and about reforming police. I think we need to have these same conversations about healthcare and ways to address this. And I guess we'll see what happens with that.
Well, that's excellent. I think that's a really good point to try to link it to these broader, hopefully, currents of reform. And that I always think, as a historian, I would think that it's always good to get a historical perspective on things that are happening, but I think that's particularly interesting and valuable. Thanks so much for taking the time to give us some historical perspective on the COVID-19 situation in New Orleans. Thanks very much.
Thank you.